Pelleting procedure for our patient. So the field is already sterile and cleaned. Now we're gonna do a small injection of lidocaine for the area where we're gonna insert the pellets. Okay, a little pinch right here. Okay, a little pinch right here. That's all. And a little burning. Yeah, just breathe, 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 breathe. So this is a localized infiltration of lidocaine into the skin, the area where we're going to use a little insertion point, cutting. And now we're doing anesthesia into the tunnel where the pellets are going to be inserted. And it's fairly comfortable procedure. The only probably part is uncomfortable when you do a small injection. Okay, we're gonna wait for a few minutes so she's completely numb. Okay. All right, so she is pretty numb. We're just gonna test that area. Do you feel me touching you?
I feel you touching, but
Okay.
I'm not.
Do you feel me touching you?
Yeah.
Okay, we could add a little bit more anesthetic just because she is sensitive or extra sensitive. Because usually is this part of the skin is the most painful one. And around this area nicely. That should be fine now. Okay, just gonna wait for a couple of more seconds just so she feels numb. Okay. Now, do you feel me touching you now?
Mm-mm.
No, good, okay. Okay, we make a small insertion. Okay. Now we're gonna use a small trocar to get into the skin. How are we doing? You okay?
Mm-hmm.
Okay. How are we doing? We good?
Mm-hmm.
And just gonna advance a little bit more, farther down. Okay. Now the pellets are actually right here, the 2 testosterone pellets. And we're gonna insert them now. I'm gonna use the tiny pellets first. Put it in there. And I'm gonna put a second pellet right. Oops. It's a challenge because they're tiny. Let me just flip this a little bit more this way. Second pellet is in. Okay. That's it. I felt them how they inserted in, and we're just gonna come out, and that's it. It's all done. How are we doing? Do you
Good.
feel it?
Mm.
No? Good. Okay. So we're gonna put a little tiny stereo strip to close our little insertion point. And one more, just for safety. Okay, now we're gonna put a sterile dressing over that area. and cover to protect that from getting wet. She'll keep the dressing for about 3 days, and then she'll remove everything in 3 days. Okay, now I need your hand. Give me your hand, please. Just put your hand right over that area. Just put a little pressure. Okay. So this is the dressing that you're gonna keep for 3 days. No strenuous exercises. We're gonna love buttocks, so you're not gonna get any biking, no squatting, no hot tubs, no swimming for the next 3 to 5 days. And that's it.